No one wants to feel unwell or feel like there's a better way of living, but it's just out of reach. When it comes to your health, you need better solutions, not Band-Aids. Wholeness is here for you.
Welcome back, Whole You Tribe. Today we are talking about kiddo sleep, and I mean the tiny ones. Mine are now 4 and 7 and sleep 10 to 12 hours a night, which I'm pretty jealous of. But I so remember how hard the newborn period is for many infants and toddlers. So this may not be applicable to all of you, but for those that it is, listen on as I have pediatrician, public health specialist, and pediatric sleep expert, Dr. Nilong Vyas, here to talk to us about all things baby and toddler sleep. Dr. Vyas has an MD from Louisiana State University and a Master's of Public Health from Tulane and is a board-certified pediatrician and sleep coach. Getting your baby to sleep is one of the most controversial, contradictory, and confusing aspects of parenting. And Dr. Vyas takes your personal parenting goals into consideration. She is knowledgeable not only of the common sleep approaches, but more importantly, has a pediatric medical knowledge base. So welcome, Dr. Vyas.
Thank you for having me.
So your patients and clients adore their sleep doctor because you consider everything when giving advice, knowing that sleep is not a solitary issue, but intimately involved with the rest of the child's holistic well-being, diet, development, and day-to-day schedule. So this is such a great research for folks, and you do virtual consults as well. So I want everyone to keep that in mind while they are listening. So let's dig into the newborn. My oldest, when he was a newborn, he slept for 35 minutes at a time for 10 weeks. I thought residency was hard. It was by far one of the hardest things I've ever done. And so I'm really excited to hear, what are your kind of top couple tips for newborn parents?
Sure. So newborns obviously should be waking up and feeding overnight. Obviously, you want them to do longer stretches than just the 30 minutes. But one of the ways that you can get them sleeping longer stretches overnight is to invest in a red light bulb. So a lot of times when babies are waking up overnight to feed, parents turn on their smartphones or flashlights or overhead lights or TVs, and those the light from those devices can stimulate the retina and cause wakefulness in the newborn. And so then all of a sudden you have a baby who initially just woke up to feed, but now is wide awake and wants to hang out and visit at 4 in the morning. So if you replace the lamp that you have in your room where the baby's sleeping overnight with a red light bulb, they can't see those red light waves, and so it doesn't cause wakefulness for the newborn, but it allows the adult to see well enough to feed the baby, change the baby, do whatever they need to do to care for the child overnight without potentially causing the newborn to become fully awake.
Well, and those kind of warmer shades, right, are better for us too as adults in terms of not stimulating the retina and like suppressing melatonin. So it'd be good for us too.
Exactly. Yeah.
Yeah, really interesting. So I remember we were talking a little bit, offline about how important sleep is and how we don't value it quite so much. And I just remember before I was a parent, someone else like leaving to go put their kid down for a nap. And I remember being like, really? Like, the kid has to take a nap at a certain time. And now it's so ridiculous for me to think back on about how I felt like that. But it really, sleep is so important for all of us, but especially for these little ones and everything that they're kind of processing and their brain development and everything. So.
Exactly. Yeah. So they're going through such rapid developmental changes in the newborn infant stage. And in our society, I think sleep is seen as a sign of weakness. Like, you want me to leave this music class to go put my baby down for a nap, or you want me to stop doing X, Y, and Z, or not do this, so that my child can sleep. And a lot of families ask me, how can I do anything? Like, how can we have a life if my baby needs 3, 4, 5 naps a day? And it's like, they're not going to need this many naps for the rest of their life, but they need it in the initial period when their body is developing the most rapidly. So it's important to put aside the activities and know that you'll have plenty of time for that once they're older. But in the interim, when they're newborns and infants, even toddlers, it's important to prioritize sleep over all those other activities. They will learn to read, write, walk, talk eventually, but they'll do it sooner and at a more rapid rate if they get their sleep.
I love that. So what's another newborn tip for us? That red light bulb was awesome.
Another thing is I recommend swaddling. And, newborns, when they're in the womb, they're in this tight, enclosed environment and feel encapsulated, and so then they're born, and it's advised by the American Academy of Pediatrics to put them on a flat surface in a crib, and they're in this large environment, and it's a lot of times hard for babies at that age to sleep well. So if you swaddle babies in the newborn time frame, it helps them feel comforted. It feels like they're still in the womb and it feels like you're still supporting them through a fourth trimester. So if you swaddle, use shushing, gentle rocking, you're recreating that womb environment, and it helps them sleep better. It's also important to start around a month of life to start noticing their sleepy cues and their hunger cues. A lot of parents mistakenly just, when the baby cries, just assume that the child must be hungry. So they're like, oh, the baby's crying. It's only been 20 minutes since they last ate, so they must be hungry again, because maybe they didn't feed well. So they'll offer the breast or the bottle again, and a baby at that age will take the breast, even if they had just eaten and even if they're full, because they have a strong suck-to-sleep association. So it's important to start noticing when they're actually sleepy and when they're actually hungry. And if you notice that if you feed a child and 20 minutes later they're fussing, then maybe it's because they have a burp or a dirty diaper. It's good to kind of go through what other potential options there may be of why the baby's crying, instead of just assuming that they're hungry and feeding them.
Yeah.
Start establishing routine and following cues.
Yeah. I loved the swaddle for my kids. My youngest he liked it. My oldest one, he probably would still be swaddled if we let him. He literally he was like over a year, and he still wanted to be in those, the swaddle dresses, kind of, not like the sheets.
Yeah.
Funny. He really loved it. I remember a couple of years ago, I'm an emergency physician, as well as a lifestyle medicine physician. And I was the middle of the night in the emergency department. I had these these new parents come in, and they lived in Dubai, or they were from Dubai, and they didn't have any family around. They had this 1-month-old who wouldn't sleep, and they were there for advice, and we were using the language line, and I was teaching them how to swaddle, using a language line. And my nurses were cracking up. They're like, "You're the only one who would be trying to teach someone how to swaddle." I was well, someone has to teach them.
Yeah, now they have swaddles, taking one of those newborn blankets that you get in the hospital and using that to swaddle is so difficult. But now they have swaddles that you can just plop the baby in and Velcro them in, and it's done. So
yeah. My oldest was a Houdini, though. He could get out of anything. So those ones with the Velcro were not enough for him.
Oh, really?
All right. So let's move on to toddlers, our crazy little sociopaths that we invite into our home here. Give us a top 2 tips to tame these little monster sleep.
So a lot of times what happens with toddlers, the mistake parents make is that they switch them out of the crib and put them into a toddler bed, or a big boy, big girl bed. And parents typically do this because there's a new baby on the way, and they're like, oh, we need the crib for the baby, so let's start transitioning the toddler out. And toddlers don't have the impulse control or the reasoning skill to stay in their beds, in their rooms, and remain safe. So I typically advise parents to keep their toddlers in their cribs as long as possible, even until they start jumping out. Once they start jumping out, then yes, you have to make that consideration and change them. But otherwise, if they're not jumping out, leave them in the crib until they're nighttime potty trained. Once they're nighttime potty trained, then you want them to be able to get out of the bed and go to the bathroom if they need to. But prior to that, if they're still in diapers, then they can stay in the crib. If there is a new baby coming, buy a second crib, borrow a crib, but don't pull them out of the crib too soon.
And why do they sleep better in that than in a regular bed?
They just feel more comforted and secure, especially if they've been in the crib since 4 months of age. They're just used to that environment. They don't understand if they have that freedom of being able to leave the toddler bed. They don't understand that, that's where they can stay safe, and that's what's going to provide adequate sleep. They're just like, oh, woo-hoo, I can run out of the room, and they end up in the parents' room. They end up in the parents' bed, and then they end up waking up overnight multiple times in order to get that sort of information from the parents. So they end up not sleeping all the way through the night because they don't have that security and comfort of the crib.
When we moved both of mine out of cribs when they were like launching themselves out of them for safety purposes.
Obviously, you keep them safe and transition them into a toddler bed. But if that happens and you want to set up the proper parameters for that toddler and let them know what the rules are of the bed and of the room, you don't want them waking up overnight and walking out of the room and walking around in the living room, potentially in the kitchen, maybe even walking out of the front door.
Yeah.
They need to know that when it's time to go to bed, it's time to go to bed, and they have to stay in the room until it's time to wake up, until you physically come in there.
We've always had these little clocks that turned on and tell the kids when they can come out, which has been really nice for my own sleep.
I love those clocks, and whoever invented them was brilliant, because it gives the child a little. You end up not being the bad guy, right? Because it's like, oh, the clock told you it's time to get up, so you must get up. So it gives them something to rely on besides you to let them know when it's time to get up.
Yeah. Any other toddler tips?
Yeah, so the other mistake that parents make with toddlers is that they drop the naps too soon. So in the newborn age, they're sleeping 5, 6 naps a day. And then in the toddler age group, they go down to potentially 1 nap a day. And so parents sometimes have a hard time knowing when to drop those naps. And typically when the toddlers, they start talking a little more and becoming a little more defiant. And so parents are like, whatever, it's not worth the fight. I'll just, maybe he doesn't need the nap. But most toddlers need naps. So I typically recommend 2 naps all the way up until age 2 years of age, and then 1 nap from 3 to 6 years of age. And every child is different, obviously, but if you base when to drop the naps based on the cues that the child is giving you. If you skip the nap and then they're just a bear to be around by 6 p.m. and they're just out of the box and not willing to eat their dinner because they're just so exhausted, then you know that it's not worth dropping the nap at that point. They still need that daytime siesta. And so if the child's fine, they're 3 or 4 years of age, they've dropped the nap and they're capable of staying awake and participating in the evening activities without an issue, without too many tantrums, then yes, it's probably fine to drop the nap. But most kids still need a nap all the way up until kindergarten.
I wish that my kids were still nap. I mean, I guess my 4-year-old still sometimes we put them in their rooms and they rest. And I'm always hopeful that just having that time of just downtime by themselves is good enough. But, you can't, I always say you can't force a kid to eat, poop, or sleep. It's sort of like you can't.
Absolutely.
You can't really make them do those things.
Exactly. But if you provide the proper environment for them to sleep, it's not like the newborn age anymore where they'll just pass out even if there's a parade going by outside. That you need to provide the proper environment for sleep. So if you bring them into the room and do the routine and read books and sing songs and, let them know, pull the curtains down, let them know it's time for sleep. Even if they don't physically sleep, but they rest, that is good enough at the toddler age. But if the proper environment is set up so that they can sleep, I mean, if they have full access to all their toys and anything that they want in their room, then no child is going to go to sleep, even if they're fully exhausted.
Yeah.
So it's providing the proper environment so that they are capable of sleeping.
That's really great. I know you also do child and tween consults as well. But most of the issues for, I think, a lot of us are mostly in the littlest. So we'll kind of leave it at that. Tell us a little bit about your Sleepless in NOLA coaching business and how you can help our listeners and how they can find you.
So if they go to www.sleeplessinnola.com, they can access my calendar and book a free 20-minute consultation, which I will personally speak to them and discuss their sleep issues and try to figure out a package or plan that would fit their lifestyle and their needs the best. And then we will schedule the consultation. The consultation can take up to 3 hours, where we discuss everything holistically, about sleep, behavior, discipline, eating habits, all of it. And then I send them a sleep plan that has all that information that we discussed in the consult within it. And then we work gradually to eliminate those associations and get their children sleeping through the night. And then there's an implementation phase where I'm on call for them to answer any questions as they do the majority of the changes. And then there's also a follow-up. So from start to finish, from the consultation to the end of everything while the child is sleeping through the night can take up to 3 months of me working with them gradually. Because you can do things quickly, obviously, but a lot of times with the quick procedures, those kids tend to regress. So This is a way to get those habits, the good habits, set into place so that there isn't potential regression later.
What a great value. I mean, not just to have someone to walk you through that, because it is such a difficult thing to know if you're doing it right. And we all have so much worry about, hurting our kids by doing something wrong, but also just to have the value of a physician and a pediatrician to be spending all of that time with you, because in the office, right, our pediatricians don't have time to talk and really provide that value. So really awesome. And I'm really thankful for you for providing that.
Thank you.
So tell us how we can find you on social media as well, so that we can follow through.
So I'm on Facebook. There's a Sleepless in NOLA page, and there's also a Sleepless in NOLA Sleep Alliance. So if you're a parent that has just a couple of questions here and there, it's a whole alliance where it's the Sleepless in NOLA team as well as others in the community that will help answer your question.
Oh, I love that.
So the Sleepless in NOLA Sleep Alliance on Facebook, as well as the Sleepless in NOLA page on Facebook. I'm also on Twitter, Instagram, and LinkedIn.
Terrific. So you can read more about Dr. Vyas at sleeplessinnola.com or on holisthealth.com with all of our Holist Network experts and practitioners. And thank you so much for joining us.
Thank you for having me.
And as always, remember, who you choose to be matters. You are valuable, you are worth this, and you are your whole you.